Hey there, guys. I'm Dr. Amara, a urologist and men's health specialist with over 15 years of experience helping men protect not just their bodies, but their confidence, their vitality, and their relationships. Today, we're diving into one of the most real, most honest, and maybe a little bit uncomfortable conversations you'll hear on the internet. It's the kind of question men quietly wonder about, search for late at night, or hesitantly ask with their eyes looking down in my clinic. But here's the thing, this is a safe space, a place where we talk about men's health, aging, and intimacy without judgment. Because when we bring these questions into the light, not only do we learn, we heal, and we realize we're never alone. Gentlemen, let me ask you something real. Once you hit your 50s, 60s, or even 70s, do you start telling yourself, well, that part of my life is behind me now? You notice the distance growing between you and your partner. Intimacy feels like something younger men do. And somewhere in your head, you accept it as just part of getting older. But here's what most men don't know, that doesn't have to be your story. Not even close. This could actually be one of the most rewarding chapters of your life, but it takes a little bit of knowledge and, honestly, a little bit of courage. So here's what I want you to do right now. Drop a comment below and tell me, where are you watching from? I've got guys reaching out from all across North America, Australia, everywhere. I love hearing from you. And while you're here, hit that like button so more men in your situation can find this video. And please subscribe. I'm dropping new content about men's health, aging, and vitality every single week. You don't want to miss it. All right, let's talk about the first big mistake I see guys making. And this one's huge. They convince themselves that aging means checking out. I had a patient come in just last week, 68 years old, and he literally said to me, Doc, I'm older now. This stuff isn't really relevant anymore. Really? Your prostate doesn't know that. Your testosterone doesn't know that. Your body is still sending signals. The issue is, most men ignore them. Or worse, they think it's just normal. Here's the reality: prostate health, testosterone levels, sexual function, these things matter at 70 just as much as they did at 40, maybe even more, because now you actually have the wisdom to appreciate what you've got. I've worked with countless men in their 60s and 70s who thought intimacy was behind them, and once they got the right information and support, their whole world opened back up. But that only happens if you stop accepting decline as inevitable. Second mistake, and I see this constantly, men ignore the warning signs their bodies are sending. You're getting up 4, 5 times a night to pee. That's not just getting older. Pain or burning when you urinate, that's your body talking. Feeling like you can't quite empty your bladder, that's a signal. And in the bedroom, if things aren't working the way they used to, a lot of guys just shrug and say, well, I guess that's just what happens. But that's exactly the wrong approach. In my 15 years, I've seen what happens when men pay attention versus when they don't. The guys who come in early, who get checked regularly, who talk to their doctor about changes, they respond to treatment. They get their quality of life back. The guys who wait, it gets harder. The longer you wait, the less effective treatment becomes. So my message is simple: listen to your body, pay attention, and get it checked out. Third mistake, and honestly, this might be the most damaging one, not talking to your partner about what's going on. A lot of men suffer in silence. They're dealing with performance issues or anxiety or just not feeling like themselves, and they never say a word to their wife or their partner. You know what happens? The distance grows, your partner starts wondering what's wrong. Maybe she thinks it's her. Maybe she thinks you're not attracted to anymore, and you're just sitting there, not communicating. I had this patient, 62, married 35 years. After a prostate procedure, things changed for him physically. He never talked to his wife about it. He just withdrew. They nearly got divorced over it, nearly threw away 35 years because of silence. But the moment they started talking, really talking, with a counselor and good medical guidance, everything shifted. Suddenly, they understood what was happening. They became a team, and their relationship got stronger, not weaker. Communication, information, and teamwork. That's the magic formula. Fourth mistake, you're not taking care of the basics. And I mean, at this stage of life, your body is like a machine. You either maintain it or it breaks down. Your diet directly impacts prostate health and sexual function. Your sleep affects your hormones. Your exercise affects everything. Too much red meat, processed stuff, sugary drinks, that's fuel for inflammation, especially in the prostate. But fish, nuts, olive oil, fruits, and vegetables, that's protective medicine. I tell my patients before you go on medication, change your lifestyle. 3 days a week of 30-minute walks, that's it. That moves the needle. 8 solid hours of sleep, that resets your whole hormonal system. These aren't boring health tips, these are performance upgrades. I've watched men's lives completely transform just by cleaning up their diet, getting serious about sleep, and moving their body regularly. It's not as flashy as a pill, but it works. And the fifth mistake, the one that really gets me, is not getting regular checkups. A lot of guys avoid the doctor. I feel fine. Why would I go? I get it. But that's exactly backwards. By the time you feel something's wrong, it's often already advanced. PSA tests, prostate exams, blood work, these should be routine after 50. Not because something's wrong, but because early detection saves lives and saves quality of life. I had a patient last year, 70 years old, no complaints at all, but his blood work and PSA numbers showed something starting to develop. We caught it early. 1 year of simple intervention, and the problem completely stopped progressing. But if he'd skipped that checkup, 5 years down the line, he could have been looking at surgery or serious treatment. Early detection. I'm telling you this from 15 years of medical practice. It changes everything. Don't skip it. So here's what I want you to walk away with today. Two things. First, getting older doesn't mean checking out. This season of your life, when you combine your experience with your health, that's powerful. That's actually peak time. And second, if you invest in yourself, if you get informed, if you get checked, if you talk openly with your partner, this can be one of the best chapters of your life. If this video helped you, please hit that like button. Seriously. When you like it, it helps the algorithm show it to more men who need to hear this. Subscribe to the channel because I'm putting out new men's health content every week. And in the comments, tell me your story. What brought you here today? What questions do you have? Because your question might be exactly what another guy needs to hear. Remember this, you're not too old. Passion doesn't have an expiration date. Vitality doesn't retire. And if you take care of yourself with intention and honesty, you can have one of the most fulfilling chapters of your entire life. Your health is your confidence. Your confidence is your connection. And that matters now just as much as it ever did. I'm Dr. Amara. Take care of yourself, and I'll see you in the next video.